just wait for some people to log on. Okay, so you have one person that's logged on.
Oh, cool.
Amy's watching at the moment. Amy Gritter.
Thank you for joining us. I'm Dr. Kenneth Beer. I'm a Palm Beach dermatologist, and today we're going to talk about various skincare products and what you should and shouldn't do for your skin. Hi Amy. I see Amy in the background there. We'll talk about prescription strength products, we'll talk about over-the-counter products, and we'll talk about things that are sort of hybrids of the two. A lot of what I think skincare is how many products you can use in a day. So if you know in your heart you're going to use 1 or 2 products, don't buy 6 or 7. And if you are really into skincare, start with 3 or 4 and then add 1 or 2 every 2 to 6 weeks, depending on what your goal is. So I guess the cornerstone of everything is some type of product kind of like this, which is Retin A Micro. And Retin A is what we call a retinoid. This is a prescription strength product, and it's been around forever. It's a great product, and Retin A Micro is the latest form of it. And what it is what are called micro sponges, and these little tiny capsules filled with Retin A, so they're slow release and more gentle. So for people that are getting irritated by regular Retin A, sometimes Retin A Micro is a nice solution. And if you're getting irritated by Retin A, there's usually something going on. A lot of times what happens is you're putting the Retin A on while your skin is still wet, and Retin A will separate into its base product and its molecule and cause irritation. So try and let your skin dry out a little bit before you put on your Retin A in the morning. And if your Retin A is still irritating you, you can let your skin get used to it, and by doing that, I'd like you to use it every other day for about 6 or 8 weeks, and then try it again every night. That'll get your skin time to get used to it and acclimated. But Retin A is a really good product for everybody. So whether you're sort of young and trying to get rid of damage, or older and trying to treat your fine lines and pigment, Retin A is a good cornerstone. The generic is obviously much cheaper than the micro, but the micro is a better product. There are various forms of Retin A, and some of them are more conducive to your use than others. There are also other products called retinoids, and what they do is they share the same background as Retin A. So they're like them but different. So they include Differin, which is now over the counter, primarily used for rosacea and acne, and Tazorac, which is also a retinoid that can be used, and it works really well. So Retin A is not only for the face, but also the neck, the arms, the hands, and there's some great studies done with Retin A that show that if you use Retin A every night for 9 weeks, the collagen and elastic fibers will start to come back in your face, your neck, your chest, your arms, everywhere. So again, Retin A is a great place to start. If you wanted to do more than that, which I think is worthwhile, I would add in something like vitamin C. And the vitamin C typically looks like this, and it's usually in a darkish bottle. And the reason why is because vitamin C is pretty unstable. So if it heats up from the sun, it'll start to decompose. That bottle of Retin A, the little tubes should last you maybe 2 weeks, 4 weeks. Vitamin C should be used every 4 to 6 weeks. So if you have a bottle that's 6 or 12 months old, probably worth investing in a new bottle. It comes as a serum, so it's sort of a light liquid, and my product has a dropper in it. I think that the dropper is really easy to control and lets you get a precise amount on. The other thing with vitamin C is because it's unstable, there are different types of vitamin C that are put in there. So there's different chemical structures that allow the vitamin C to be more stable. So that's a great product. So if you're going to use 2 products, I would say the vitamin C and a retinoid like Retin A. If you're going to add to that regimen, I would use a cleanser or an exfoliator. The exfoliator that we have, which I think is very good, is called the White Bamboo Exfoliator, and again, all of these are available on our website. But the White Bamboo Exfoliator is a great way to polish the surface of your skin. It's great to use in the shower, and what you can do is buff out some of the debris that accumulates on the skin. Because it's an exfoliator, you wouldn't want to do it all the time, and you wouldn't want to irritate your skin. So what you do is you use that 2 or 3 times a week, and that'll help cycle your skin. From the bottom of your skin to the top of the surface of your skin takes about 28 days. So when you're starting a new skincare line, it's worth remembering that, because you're not going to see changes immediately. The cells that are on the bottom of the skin have to cycle all the way through, and that takes about a month, sometimes a little bit longer. So again, if you're going to use a few products, the exfoliator is a great one, the vitamin C is a great one, and then a retinoid. Next up on the list, what we see is a lot of people with pigment abnormalities. Now, we treat that a lot in the office with chemical peels. We also use lasers like Fraxel or CO2 to resurface the skin. And chemical peels can be the subject of a whole other session, and maybe we'll do that. There's all kinds. There's glycolic, there's salicylic, and we use a lot of salicylic because sal acid is great for pigment and fine lines. It's also pretty comfortable because it neutralizes itself. If you wanted to use something to lighten your skin, we like this product, which is a brightening serum. And the brightening serum has botanical extracts to lighten the skin. There are other ways to lighten your skin. So there's prescription strength hydroquinone, and usually that's 4%, and that helps a lot with pigment. You have to use it with sunscreen, of course, otherwise you'll just make more pigment. But it's worthwhile trying that. If you're not going to use hydroquinone, and a lot of countries have banned it because of a theoretical risk of sun damage and skin cancer, then you should use the botanical products like the brightening serum. So there's our brightening serum, there's other products that have different types of complexes. Some of them are from mushrooms, some of them are derived from licorice, like licoric acid. There's a whole range of products that are wonderful for brightening the skin. The key is to be consistent and use high number sunscreen, or better yet, sunblock. And the difference is a sunblock is like an umbrella for your skin, whereas a sunscreen is sort of like a sponge, and it tries to gather up all the sun damage it can and filter all the sun. So in my estimation, it's better to reflect the sun than to absorb it. Everybody has to clean their skin, and some people use a bar of soap. It's okay if your skin is sort of oily and thick. Might not be the best bet for you if your skin is sensitive. And for sensitive skin, we have a very nice calming cleanser. Ours has green tea in it, and it's really nice, particularly if you have any irritation or rosacea or any type of inflammatory response on your skin. We have all kinds of other products. We have a pH balancing cleanser, which is a really nice way to calm down your skin as well. So there's all kinds of stuff that we can use. Finally, there's some other products that we have here called a daily hydrating cream. And what the hydrating cream does is it incorporates hyaluronic acid filling spheres and basically carries the moisture deep into the skin. So this will help hydrate your skin and thicken it. It'll also help to get rid of some of the fine lines, even if it's just temporary because of the swelling that occurs as your skin absorbs the moisture. The lifting serum is another product that I like a real lot, and what it has is a bunch of different ingredients, but what they'll do is help to form a film on the skin surface to make your skin less wrinkled in appearance. It also has a retinol in there, so not only will you get an immediate fix, but you get a really nice long-term improvement of the appearance of the skin. So this product is really a nice way to go. When you're using any type of product, I don't really like products that are mixtures of sunscreens and cleansers and sunscreens and moisturizers. I mean, you live in very different parts of the world, and in the United States and even in Florida. Some people get a lot of sun, some people don't. I think that if you're not going to be out in direct sunlight for more than 5 or 10 minutes, maybe using 100 SPF is a little bit more than your skin needs. If you're just going to work or going to the gym, and you're doing a 50-yard dash to the car, I really wouldn't put sunscreen on my skin. For 2 reasons. One, a little bit of sun is not really going to be that bad. It's good for your brain to cycle the hormones. I also think that it's great for some vitamin D. And the other reason is by adding all these sunscreens, you're going to irritate your skin. So I love sun protection, and I'm a big advocate of doing that. But I think that it's ridiculous to try and do it every day if you're not going to be outside. I also don't like it if it's mixed in as an afterthought to other products. So my products are very focused, and you see that in a lot of other products now too, which is wonderful. But what you want to do is get a sun protection product. One of the ones we like here is from Alastin, and Alastin makes a variety of really, really nice products. This is a mineral-based tinted sun protection that's 36 SPF. And what that allows you to do is put it on, have a little bit of color in your skin, and that works instantly. So in contrast with something like sunscreens, the sun shield or sun block will act pretty much instantaneously. Sunscreens require 15-20 minutes to activate. So the first few minutes you're outside in the sun, what's happening is you're really giving your skin a little bit of a workout. And you don't really want to do that because you'll burn. There's so many sunscreens out there. They range in price from $3 or $4 up to $200 or $300. Not much of a difference in the structures chemically. If I had to go out and get stuff, there's a million products that are great. Again, we like the Alastin here because it's just a really nice tinted, easy to apply product. What else? We have so many products to talk about. If you're going to be traveling a lot, you probably want to use a hydrating or barrier type of lotion. We see products that are really good for the skin that'll help hydrate, and those are really nice to use when you're traveling. In Florida, probably during the summer months, you probably wouldn't need that much hydration because the relative humidity is so high. But up north in the various northern or western states, you probably do still need some humidity and moisture, particularly in the night time when you're sleeping, because if the humidity in the room that you're sleeping in drops, it'll really do a number and suck out all of the humidity in your skin. So you'll wake up dry, and we can certainly talk about various different products. There's all kinds of stuff we can use here. And some of the other things that are really popular, both with us and with other manufacturers, are these clearing pads, which are glycolic acid and salicylic acid. And what they do is they help to minimize the appearance of fine lines and wrinkles. And they're really a nice peeling system, easy to use, disposable, and you can use those a few times a day. So there's that. Then there are all kinds of other things that we use on a daily basis. So the mild cleanser is one of them. And then obviously you put all this stuff on under your makeup. And when you're applying stuff, you want to put the active ingredients on first and let them get through the skin. It takes about 15 or 20 minutes to do that. So when we're talking about a daily skincare regimen, you have to think through that you need a little bit of time to do it. You can't just pile them one on top of the other. The other thing that I have a lot of patients asking about is how come the stuff isn't working? And when you speak to them for a little bit, you find out that what they've done is they put on the sun protection as a layer or a moisturizer as a layer, and then they put the vitamin C or Retin A on, and what they're basically doing is putting it on a barrier that the active ingredient can't get through. So always put your active ingredients on first and let it get through the skin for anywhere from 10 to 15 minutes. So that's another really important tip that you want to do. And when you're trying new products, give them a chance to work. Don't give them 2 or 3 days. Give them 6 or 8 weeks. And then if you don't like them, try something else, but figure out why you didn't like it. Were they drying? Were they irritating? Did they not do what they were supposed to do? Most products today are so well made and well engineered, they tend to be really good after about a month. So there's a lot of stuff that we can add to the mix. Other things I like to add are other botanicals. There's all kinds of botanical extracts like glycyrrhizic acid and other roots that calm the skin. Elizabeth just asked, why is exfoliating important? That's a great question. Exfoliating is important because the surface of the skin just accumulates damage and schmutz. So you want to polish the skin surface as much as you can and try and clean the palette. Once you have a nice canvas to work with, all of your active ingredients are going to work much, much better. And I think you'll find that your skin looks better and feels better after that. But that's a great question. So other actives. Niacin and niacinamide have been around forever. People have used them as oral medications, and they're very, very, very strong and good anti-inflammatories. So I like niacin and niacinamide. There are several products that incorporate them. Niacin and niacinamide are different, and you wouldn't want to take one and switch it for the other because you can have all kinds of problems. Stick with niacinamide by mouth and niacin topically. And those products have been shown to decrease the incidence of skin cancer as well as to brighten the skin and help to treat fine lines and aging. So niacin, niacinamide are wonderful products. You should try and stick with them. If you really want to go and do more advanced stuff, there are several extracts available. And some of the extracts are things like extract from seaweed, and the botanicals and the molecules and the minerals found in seaweed can be very, very helpful. Most seaweed tends to be very rich in magnesium, sodium, potassium, and things that the skin will use. There are also proteins that are used now, and they're helpful as well. One thing that I don't think is helpful to a skincare regime is some of the newer products like edible collagen. I don't think that edible collagen is going to get absorbed in any meaningful amount. So what I really recommend is staying away from edible collagen and using more of a topical based product like a hyaluronic acid. So that's my recommendation for skincare regimes. There are some prescriptions that you may want to talk about with your physician, and that is Triluma and hydroquinone. Sometimes we compound them, and by compounding we make them or have them made for us. The benefit of doing that is you can make it any strength you want. And sometimes the local compounding pharmacies will make a really nice supply of it using a 6% hydroquinone and a very strong cortisone in the base. And what that'll do is it'll bleach the skin really quickly in a number of weeks and decrease the inflammation. So that's a good way to do it. The Triluma is one of the products that's a prescription, and it includes a retinoid, it includes a brightening or bleaching product, and it includes a topical steroid. That's an old formula that was formulated by Dr. Albert Kligman, and he was the inventor of Retin A, which was the first cosmeceutical. So again, when we're talking about skincare regimens, there's so many interesting things to do that once you find a regimen, you should try and stick with it and probably add to it. So there's all kinds of things we can always add. In addition to topicals, there are some nutraceuticals that we can talk about on another day. So there's all kinds of fun stuff we have here, and there's all kinds of stuff that are available at your dermatologist or plastic surgeon's office. There's all kinds of stuff available at department stores. I think you should work with somebody that knows your skin like a dermatologist or plastic surgeon. I think in the end you'll get better results and much better outcomes, and probably save you some money as well. So with that, I'd like to thank all of you guys for being here and participating. There's plenty of stuff we can talk about. So I'll welcome you to attend these on an ongoing basis. And what we'll do is we'll answer any questions and talk about anything that you guys want. There's a lot of stuff going on now. So it's an exciting time in dermatology. And there are really great products that are available now and more that are on the way. So I want to thank you for sitting in on this. And again, any questions, we're available. And you can always visit the website, beerdermatology.com. Thank you.